In this module, we will talk about chronic kidney disease, or CKD. We will talk about what happens when the kidneys are sick, how you feel when the kidneys are sick and not working very well, and what the stages of chronic kidney disease, or CKD, means. Your kidney care team often talk about CKD stages, but what does that really mean for you? Before we move on, let's review 4 important jobs of the kidneys. Kidneys remove waste from your body. Kidneys keep important minerals like salt and potassium balanced. Kidneys regulate the amount of water in your body. Kidneys produce hormones to help make blood, control your blood pressure, and keep your bones and teeth strong. What happens if your kidneys are sick and not able to do the important jobs for your body? Kidneys may not work very well because of diabetes or high blood pressure. So, if the kidneys are not able to do their job, the waste can build up. You will keep the extra water and become swollen. Minerals and chemicals like salt and potassium will be out of balance. Your blood pressure will go up, and this can further damage your kidneys. You will have less red blood cells, so your blood will be weaker. Your bones and teeth will be softer and break more easily. If the kidneys are not doing their job, what symptoms might you have? The symptoms of chronic kidney disease are different for many people. Some people don't have any symptoms, or at least don't think that they have any symptoms. Many of the symptoms we will talk about may be caused by other health problems. The only way you know if your symptoms are caused by chronic kidney disease is to see your doctor and have blood and urine tests done. Please know that low back pain is not a sign of chronic kidney disease. The kidneys are located much higher than your low back. As mentioned, symptoms of chronic kidney disease can vary from person to person, and some people might have very few symptoms, and some people may have many symptoms. Some of these symptoms include being tired and weak, leg cramps, trouble concentrating, having no appetite or having a bad taste in your mouth, nausea, early morning vomiting, and weight loss. Other symptoms include swollen eyes in the morning, swollen fingers, feet, legs, and belly, shortness of breath, itching, easy bruising, problem sleeping, changing in the color of your skin, and decrease in sexual desire. You may have no symptoms until your kidney function is quite low. So, what are the stages of chronic kidney disease? There are 5 stages of chronic kidney disease. The only way to find out if you have chronic kidney disease is to have blood and urine tests done by your family doctor or nurse practitioner. The stages of chronic kidney disease are based on GFR. GFR stands for glomerular filtration rate, or percent of kidney function. It is a test that tells us how well your kidneys are filtering out the waste products from your body. To calculate the GFR, or percent kidney function, a blood test measuring serum creatinine, which is a body waste, must be done. When we know the GFR, or percent kidney function, we can tell you what stage your kidney function is at. The stages range from mild damage in stage 1 to complete kidney failure in stage 5. If the GFR, or percent kidney function, is high, this means that the kidneys are still working well. If the GFR, or percent kidney function, is low, this means that the kidneys are not working well. At stage 1, how the kidney removes waste products is normal, but there may be a slight amount of kidney damage, such as on kidney ultrasound or found in the urine. Some people may have cysts, which are fluid-filled sacs, or there may be a very small amount of blood in the urine that you do not see. People do not have symptoms of kidney disease. However, if you have risk factors for chronic kidney disease, the sooner you have your kidney function checked, the better. At stage 2, there is mild loss of kidney function. Your GFR is 60 to 89, or your kidney function is 60 to 89%. There are no symptoms associated with stage 2 kidney disease. In the diagram, the red is the amount of kidney that is damaged. Again, if you have risk factors for chronic kidney disease, you should have your kidney function checked. Your blood pressure should be checked, and if you have diabetes, it is important to have as good blood sugar control as you can manage. At stage 3A, the GFR is 45 to 59, or your kidney function is 45 to 59%. This is called mild to moderate decrease in kidney function. Some people may have mild symptoms. Most people find out they have chronic kidney disease at stage 3, 4, or 5. Again, in this diagram, the red is the part of the kidney that is damaged and not working well. People with risk factors for kidney disease need to have their kidney function checked at least every year and sometimes more often. At this stage, it is important to have good blood pressure control, as this can slow the loss of kidney function. If you have diabetes, it is also important to manage your blood sugars. At stage 3B, the GFR is 30 to 44, or your kidney function is 30 to 44%. This is a moderate to severe decrease in kidney function. Most people will have some type of symptom if they are honest with themselves. The reason why stage 3 is divided into A and B is that stage 3B is more likely to go on to further damage and further decrease in kidney function. Again, the red is the part of the kidney that is damaged and not working well. Blood pressure and blood sugar control are important to slow the loss of kidney function. At stage 4 chronic kidney disease, the GFR is 15 to 29, or your kidney function is 15 to 29%. Almost all people will have some symptoms of kidney disease. At this stage, it is important to start thinking about treatment choices if the kidney function continues to decrease. We will talk about these treatment choices in later modules. At stage 5, the kidney function is 15% or less. This stage is often called end-stage kidney disease. The kidneys are severely damaged. A decision about treatment choices should have already been made, and preparation for this choice should be underway. People will have more symptoms of chronic kidney disease with stage 5 chronic kidney disease. In this module, we have talked about what happens when your kidneys are sick, how you feel when the kidneys are not able to do important jobs for the body, and what the stages of chronic kidney disease, or CKD, mean when you see your kidney care team. If there is anything more you would like to know, please write down your questions and ask someone on your kidney care team.